Hi, I am Praveen Pushkar, consultant urologist in Medicant Hospital, Bokaro. And I've got my colleague with me, Mr. Rajiv Pillai from Colchester Hospital, United Kingdom. And we are here to bring awareness about the prostate cancer programs in India.
Thank you, Praveen. Thank you for introducing me. It's a pleasure to be here in this fantastic hospital. I've been a consultant in urology for the last 10 years.
Great.
But my subspecialty interest is uro-oncology, especially prostate cancer surgery, robotic surgery, and prostate cancer diagnosis.
Great, great.
As you know, Praveen, there is a lot of awareness in UK about prostate cancer. 1 in 8 men are diagnosed with prostate cancer. The annual prostate cancer incidence is somewhere around 50,000, but there are a lot of cancer registries with robust data, so we are able to pick up prostate cancer and we're able to record the numbers. What do you think is the incidence or prevalence in India?
Obviously, in India being such a large country, there is little bit lack of data over here, and there is no such actually nationalized programs which actually do registers all the prostate cancer from all different states. Still, there are some data from the Indian Council of Medical Research, which has come up in 2020, I think. They have told about something around 40,000 incidents of prostate cancer per year. And they also say that, especially in the metro cities like in Delhi and all, prostate cancer remains the second leading cause of cancer in men's. Then they have also said about some other cities like Bangalore and all, where it has the third most common prostate cancer. And rest of the country also, they have come with the data like it is among the one of the 10 most common diagnosed cancers. And data is definitely, the incidence and prevalence are increasing in India. The more the awareness is increasing, the more the screening programs are running, the way it is like coming up. Obviously, it can't reach to that UK level right now because it's still the awareness was quite for a long time. Now this is quite increasing in the recent years in India.
So, what do you think we should do to increase that awareness in India?
There are a lot of things to be done, especially one definitely from the public side and also from the government side. The government, obviously, they will require some to increase the awareness program, not only for the prostate cancer, for the other cancers too, to increase the awareness about how to do the screening and which all age groups are required to do the screening for the prostate cancer. And for the also the lessons to be learned for the primary physicians, the healthcare workers, because India is basically a rural country. So most of the population resides in villages and tier 3 cities, not in metros basically. So over on those, in those places, like most of the general practitioners, they should know, they should be educated to how to do the screening of this prostate cancer. And once they do that, they can obviously send the patients to the tertiary care centers. Now the government of India has opened recently All India Institute of Medical Sciences in almost all states of India. So there, one tertiary care is definitely there in all states, that is a government sponsored. Then they have so many private hospitals which are coming. Now this Medicant hospital is one of those, which are tertiary care hospital in the state of Jharkhand, one of the biggest. So this kind of hospital will be the like a center point around whom all the states like small general practitioners can work, and then they can just start diagnose, because they will be the primary point where the patient first comes, and they can just refer the patients to us. Obviously, the one thing is definitely the health awareness campaigns to increase the awareness, education. This is all what is required.
So, as you know, you worked in UK. There is a selective screening program in UK for prostate cancers, which helps with early detection.
Yeah.
So patients can go to their general practitioners and ask for a blood test, PSA, which is currently the best available screening test for prostate cancer. And based on that, they get a referral if the PSA is high for their age-specific range.
Right.
And then they come to this tertiary hospital or secondary care, as we call it, and then we investigate them further. So we do a clinical history taking examination, they have an MRI scan, and some of those patients then go on to have prostate biopsies. How do you work up a patient in India?
Most of the times we get patients from, again, for a tertiary care centers, we get patients from general practitioners when the PSA is high. That is and some of the patients definitely can come directly in India to ourselves, like, because there is no tier system like in NHS that you have to primarily go to the GPs. So here they can directly reach out to us or any of the urologists in the country. And what I feel that few percentage of people are definitely, they are quite aware that they have to get this PSA done quite frequently. So they keep on doing, but majority, they don't know, they don't have this much awareness. So they go to the general practitioner for some other reasons, or maybe a little bit of lower unit tract symptoms. So the general practice nowadays, they put this PSA definitely with them. Many a times, definitely what I have seen, lower tract symptoms pertaining to urinary infection they go for, and they get the PSA done at the same time, and that time the PSA is seriously high, and they become very anxious and they refer to us. So obviously that is not needed, the PSA to be done during the infection. So if not leaving this part of the patients, rest they come from the general practitioner with a raised PSA, they come to us, we do the again the same kind of digital rectal examination and the history taking and the rest of the other examination. We do a simple ultrasound examination just to see that how the prostate and everything is working, routine urine examination just to rule out the infection part, then obviously the MRI and the rest of the things. If the MRI comes up with some which is relating to the cancer, then we go for the biopsy. How do you do the biopsies in UK? What are the standard protocols over there?
So, as you know, biopsy is the crux of diagnosing prostate cancer. And in the past, a lot of the biopsies were done through the transanal or transrectal route. Over the last 7 to 10 years, there's been a big change in the way we do the biopsies. And we do, in a lot of centers, we do them through the perineum now. And we don't have to do them transrectally with advancements in MRI, advancements in ultrasound, advancements in biopsy techniques, and advancements in the gadgets available for the biopsies. Right. It's been a big revolution. You know, we do them transperineally now, and that which has got its own advantages of transrectal biopsies.
True.
And what about in India?
So in India, still we are doing this transrectal route only. I know the changes there for last 7 to 8 years. Most of the guidelines, I think they have a strong recommendation for transperineal biopsy. But India, I think 99% of the centers are still pertaining to this transrectal route. I think 1 or 2 centers which I know, they are doing this transperineal biopsies. One of the major points which I see that why we are not able to change to the transperineal route is because of this side firing transducer probes which are required for the transperineal biopsies. So that is actually not available with many of the ultrasound machines, and that is one of the hitch point why we are not able to transfer to this transperineal route in India. So Rajiv, tell me one thing. You are doing this transperineal biopsy for long, so many years now. So how much do you think it is advantageous over the transrectal, or do you think that for a country like India, where we have this problem with the financial things is always there, so do you think we can continue with this transrectal on this part of the country?
Absolutely. I think whenever we start a new technique or technology, there's always going to be challenges. And that happened in UK quite some time back. But now most urologists are convinced that transperineal biopsy is a no-brainer because of several reasons really. And one of the main reasons is the very low incidence of infection or sepsis with transperineal biopsies. And as you know, with transrectal biopsies, because you're going through the rectum, there is a incidence of infection as well as septicemia. And by doing transperineal biopsies, you're avoiding that. So the infection rates are quite low, and in some series, it's been as low as 0.1%. Obviously, there's some series which is reported slightly higher incidence. So that's one big advantage. The second advantage is that with transrectal biopsies, you can't access certain areas of the prostate, such as the apex of the prostate or the anterior region of the prostate. So with transperineal biopsies, there's no restrictions. You can access all parts of the prostate, and you get a detailed mapping of the prostate, which enables you to plan the treatment.
Can you just describe a little bit why it is like for the anterior lobe and the apex of the prostate, it is so difficult with this transrectal route?
Yeah. So as you know, with the transperineal biopsies, you have a coaxial needle and you have a special probe, and you have got an access device which enables you to access different parts of the prostate using the coaxial needle. and most of the time with a single puncture on each side. So it's the way we do the biopsies, whereas with the transrectal route, you only have, you are going at an angle
Yeah,
into the prostate.
right.
So sometimes it's difficult to target a particular area which is too anterior, or apical prostate, which is very difficult to angle when you're doing a transrectal biopsy.
Right. Many of my colleagues say that you hold the ear from this side or the other side. You are doing the biopsy, whether you have to diagnose a cancer, whether you do this way or that way. But I think the infection part is one of the main concerns, and the other thing is that as you told, that some parts of the prostate, especially the apex and the anterior lobe, it's not that easily that won't be covered with the transrectal route. So those areas can easily be missed on the transrectal biopsy.
And also, I think when you are planning treatment,
Yeah.
say for brachytherapy, or you're planning robotic prostatectomy, you want to know where the cancer is predominant, you want to know where there is no cancer. So if you're doing a nerve sparing prostatectomy, you can really close to that particular area. And transperineal biopsies, as you know, offers you that advantage that you are mapping the whole prostate,
Right.
and you're not missing out on any part of the prostate.
Yeah. Is it like advantage, like as you told about while doing the robotic prostatectomies? So the apex, what I feel is quite important, like where the margins are more commonly like positive are there. So if the apex we are getting an advantage for the transperineal biopsy, that will be one key point, like we can just know that the apex is, the cancer is there, so that we can be more careful, because most of the times we get the margins are positive in apex only.
Absolutely. I think much more precise transperineal biopsies is much more precise. Infection rates are low, and it's an easy learning curve. I think just similar to transrectal biopsies.
This is one thing I want to know, that because now if this transperineal biopsy has to come in India, there are so many urologists practicing over here, and they are doing the transrectal for so long, and they want to know basically that how much easy is this learning curve while they will be switching to this transperineal ones.
That's a very good question. So I can talk about my personal experience.
Right, yeah,
I can talk about the experience within our department, and I can tell you how popular it is now.
Right.
Not only in my department, but in the whole of UK. So the learning curve, as I remember from my transrectal biopsy learning, was somewhere around 5 to 10 cases.
Wow.
Okay. So, and some people, as you know, some people take a bit more, some people take a bit less.
Yeah, definitely.
And you know, you could easily say within 20 cases, you can then independently run or do the biopsies. And it's very similar to the transperineal freehand biopsies. Now, in the past, as you know, transperineal biopsies used to be done through a grid, and there was a Basel technique.
Right.
That had a bigger learning curve.
Okay.
And also, because it was done under anesthesia, it wasn't that popular.
Yeah.
But with the freehand techniques and with all the available gadgets and access needles and we have, it's become a lot more easier. So we, in our department, the biopsies are done by fellows, registrars, nurse practitioners.
That's
So,
great.
you know, our nurse practitioner, she looked at a learning curve, and it was not more than 10 cases. She
Wow.
was independent before that. So it's something you can easily adopt and adapt to.
That needs to be known, because in India, most of the, I think 90 to 95% of the biopsies will be done by urologists, and 5% of the, I think the radiologist people also do this biopsy. So if the nurses can learn biopsy in 5 to 10 cases, obviously the doctors like a radiologist or a urologist, and those urologists who are already doing transrectal, I think it will be an easy path for them to get converted to this transperineal.
Absolutely.
Rajiv, you just mentioned about this, some of the gadgets available for this transperineal biopsy. I would like to know more about this one.
For any procedure to be effective, you need good tools.
Right.
And that's quite important, especially for transperineal biopsies. So you need a good ultrasound machine, you need a good transrectal probe,
Right.
and you need certain access devices like you have. So in my practice, I use a Surefire device, which is a plastic device which you mount on the probe,
Okay.
and then you have a coaxial needle which you then insert through the perineum, and then you have the biopsy gun or biopsy needle which you introduce through the coaxial needle. And because of the freehand nature of the technique, you can modify the position of the probe and thereby accessing different parts of the prostate. So in essence, you're covering the whole prostate with pretty much 3 or 4 needle insertions through the perineal skin.
That is because of this coaxial needle, right?
That is because of the coaxial needle.
So when we talk about this much of gadgets which are actually additional to this transperineal biopsies, how is it cost effective in an NHS?
Yes, it is. So when the technique was introduced, there was only one company manufacturing it. But now you've got lots of different companies manufacturing these gadgets or devices. So the cost has come down,
Okay.
and depending upon where it's manufactured, the cost can be brought down quite a lot.
Right.
Interestingly, NICE did a cost effectiveness. NICE is National Institute of Health and Care Excellence in UK, which is a regulatory body.
Yeah.
And they did a cost effectiveness analysis in 2021 or 2022.
Okay.
And they found that because of the low risk of infection and low sort of side effects from the transperineal biopsies, essentially it's a cost effective procedure. But obviously India is a different healthcare sector. So what I'm trying to say is that, you will, because of all the competition you have in the market, you can, the cost, essentially you can do a transperineal biopsies with the same cost as a transrectal biopsies.
Yeah, this is what I came to know. Like, a few of the companies are coming to India to manufacture all these gadgets, and they have, I think, started manufacturing it also. So that will bring down the cost of all these gadgets, right? And whatever we can do this transperineal biopsy also almost on the same rate what was done for the transrectal biopsy. One of the costly thing is like this probe, I think, which will be the costly affair for all the hospitals to get involved into. And rest, I think, gadgets will be covered under this, the package for the, whether it is a transrectal or transperineal. I think in India also it will be something around near about the same.
Yes, I think interesting thing you mentioned about the probe. Again, I think lot of companies now are investing in those ultrasound machines and the probes.
Right.
So I'm pretty sure the cost of those machines and probes will come down as well, making it more affordable for hospitals to use it.
I think one of the companies has come up with this only the transrectal side firing gun only, and without the machine, that will be more cost effective for, especially for the country like India.
Absolutely.
Yeah.
As you know, Praveen, in UK we have largely shifted to transperineal biopsies, and one of the biggest reasons for that is good for the patients. Patient reported outcomes, and with the low infection rates, there's a big advantage for the actual patient. What do you think is going to happen in India? Do you think over the next few years you will see a big change from transrectal to transperineal biopsies? And what are the hurdles you see in lying ahead in the future when you're going to shift from one technique to another?
Yeah, it is quite a possibility, like we will be changing to the transperineal route now. It is already happening in India. As I mentioned earlier, that 1 or 2 hospitals are already doing it. Like this hospital is in the eastern part of the country where nobody is doing this, and we are trying to represent this as a nodal center for the eastern India, where we will be starting this transperineal biopsy. And sooner or later, I think, because this is the future, already all the guidelines say that they have got already with a strong recommendation for to convert to the transperineal route. So everybody has to come to this transperineal. There are a few hitch points because of the cost and a little bit of the learning curve. As you already mentioned, the learning curve is not that huge. So 5 or 10 cases for a urologist. So I think the urologist will be transferring to this transperineal route soon. And little bit as few of the companies are coming up with the manufacturing units in India, so they will be put down this cost for all the gadgets involved in the transperineal biopsy. So I think in the next couple of years, you will be seeing a huge transformation in how we do the biopsy. It will be converting to the transperineal biopsy, definitely. Yeah, thank you so much of coming over here to Bokaro from United Kingdom to spread this awareness about the prostate cancer program. It is actually very much needed in especially the country like India, where the awareness is actually lacking, and I feel that more and more this kind of interaction should be there, and more of discussion should be there about the prostate cancer awareness program, then only we can increase this awareness, the treatment of the prostate cancer in India. Thank you so much, Rajiv.